on, Mo. Good boy. Come on.
Welcome to Moments of Experience, a podcast inspired by my faithful best friend, Mo, a 14-year-old beagle who gave us moments of hope, compassion, and love during a time of tragic loss and life-threatening family illness. I'm your host, Geoffrey Smith, and I invite you to join me for powerful, uplifting, and sometimes even challenging conversations with some of the world's leading innovators in employee, patient, caregiver, and human experience. Together, we dive into the meaningful moments that shape us, move us, and inspire us to pursue our purpose in life. I'm glad you chose to join us as we explore the big and small moments that bring meaning to our lives and connect us to our true calling. So welcome to a brand new episode of Moments of Experience. I'm so excited to talk with my guests today. As people that listen to this show know, I don't like canned bios. I think they're boring. So I always introduce my guest in my own words. And Meredith Mangold is a purposeful founder, a certified patient experience professional, and an innovative guide to digital health teams that through her own lived experiences with chronic pain helps them translate the messy human complexity of the patient journey into shaping patient-centered tools and platforms that patients choose, trust, and rely on. So I will now, Meredith, ask you to introduce yourself.
I honestly couldn't do better, but yes, I am Meredith Mangold. I'm here in the Rockville, Maryland, DC area. And that's exactly what I do. I use my own professional and lived patient experience to help clinicians and digital health innovators really understand what patients actually navigate seeking care, what it looks like, what it feels like, so they can create solutions that patients will say, oh, they really get me and my experience, and therefore, they will engage and there's, increased retention and ultimately improving the outcomes for everyone involved. So I'm kind of like the patient insider in the room. And I just love helping those people have kind of the aha moments of, oh, I didn't know patients navigated this. And that's something that we can really use in our product or this care experience we're creating. So that's exactly it.
Yeah, I've heard you say in the past that you help these digital health companies speak patient. So that's a really great way to put it. And I'm very synergistic with a lot of the work I do, which we'll talk about in a minute. But if you could just briefly, and I know it's tough to say briefly, but just share with the audience a little bit about your story, just to give the context of what you've been through with chronic, pain and how it's led to this purposeful journey.
Sure. As many people navigating chronic conditions experience, it's been a whirlwind, roller coaster, whatever analogy you want to use. But I didn't intend to get into healthcare. I was studying Arabic at Georgetown University. It was my sophomore year, and I was totally fine one day. And then within about a week, I was crashing in the ICU. They didn't know what was happening. They did an emergency colonoscopy, and it turned out that I had severe ulcerative colitis to the level that's called toxic megacolon. So I was on the verge of sepsis. Usually that requires emergency surgery, but due to an amazing attending, she thought about cyclosporin, which is traditionally an anti-rejection med for transplant patients. And that got me under control enough that I could avoid emergency surgery. But I called Georgetown Hospital my home for about 2 months. And that was a kind of crash course in what our healthcare system is like. No one teaches you as a patient, or luckily my parents were there. So I was 20 years old. And so no one teaches you what this is like to go through an inpatient hospitalization or what it's like when you get discharged. And so I had to withdraw from school. And then recovered over the summer, went back to school, went back into the hospital, rinsed, repeat. Took off my senior year to get surgeries. So I had a total proctocolectomy. So they removed my large intestine and my rectum. And after all of that, I said, wow, that was not fun, this experience of being a patient. And, I'm very fortunate that I have I had good insurance. I had my parents with me who have stable jobs, and I'm pretty, you know, um, articulate, and my health literacy is pretty good. But still, it was so difficult to navigate. But it's I just love what you talk about, because it was really these individual small moments that made all the difference, and really encouraged me to say, okay, I need to do whatever I can to help improve the patient experience. And the way I love doing that is to help other stakeholders really understand what we go through. So I was able to graduate. I ended up working in medical practices and hospitals and digital health. And it's just what really fills my cup. And I love helping other patients navigate care, because again, no one teaches you. But yeah, it's a true passion of mine now. And my husband always says that, even if you don't make money from what you're doing, he says, like, I just see you light up when you're helping other patients. And so that's what brought me to founding Empower Health Strategies. And it can be hard to kind of champion the patient every day. There's sometimes some misunderstanding or resistance to why patient experience and bringing on advocates and patient experts is important. So thank you for creating this podcast, because I literally listen to your episodes when I need a boost to know that there are other people out there doing the good work. So I love what I do, even though it was not at all what I anticipated doing.
Well, what it is, is both passionate and purposeful, and as I said, makes you light up. But also, in navigating the healthcare system, as you've talked about, it's also a very frustrating job we have to innovate an industry that is opposed to innovation, that is opposed to taking the two sides of the coin, the employee and the caregiver side and the patient side. I say, in most health systems I go to, patient experience and employee experience, employee experience, my work, patient experience, your work, sit in two separate ivory towers and don't even communicate. And that's always something that's really blown me away about it. And when you talk about navigation, so I have over 25 years in employee benefits. I understand every bit of how to work, your healthcare benefits and all of that stuff. And the system runs me over as I'm acting as a caregiver for my wife. And I have all that knowledge, and I know, what's covered, what isn't, and all of those things. And it just pains me to think, and it's the reason why I love people like you and Claudia Cometa, who's a patient, patient advocate, is it gives a voice to the voiceless. And so I appreciate what you do.
Thank you. And same to you. As I've been talking with innovators, I bring up the same thing about employee experience and patient experience. And so thank you for teaching that to me. It was intuitive, but just hearing you put it in those specific words, I thought, oh yeah, of course. So thank you for sharing that.
And that's really how we start every show, is talk about what resonates with me about my guest's work, because without something resonating or without learning something from you, I wouldn't invite you on. And it was interesting that I'm a part of a group called the Healthcare Reinvention Collaborative. Everyone should look that up if you're someone, trying to innovate, as I said, an industry opposed to innovation. So there are like minds across patient experience, employee experience, doctors, nurses, systems people, every single angle of healthcare are all getting together to take all of their expertise and try to make a difference. And I was on an event where they were actually shining a light on my work. They were having me explain to the group what I do, my challenges, what the group can help me with, all these things, a very supportive group. And just in the chat, I got a direct message from someone I've never met. And they said, you need to meet Meredith Mangold. And that's how we were introduced, because when I looked you up, I said, oh yes, we do need to meet. So what has resonated with me is we are on a very parallel journey. We both took lived experiences, you living it like truly a lot worse than I had to, but me observing the patient journey during my wife's battle with cancer. And that lived experience has led us both down a purposeful path of supporting entrepreneurs and innovators in health tech and digital health solutions that are truly trying to impact, in my case, those that provide the care, so that they can provide an extraordinary human experience to your side, which is focused on the patient experience. So if you think about it, me and Meredith do very similar things, but I'm focusing on the people providing the care, and she's focusing on the people receiving the care. And the beauty of it, and that's why I said I don't like the fact that these two sides of the coin don't collaborate enough, is both sides are equally important to impacting patient outcomes.
100%. And when I talk with innovators, I help them remember that, sure, this is the point of care that you're helping patients, but there are other actors involved in that point of care. And so I'm always trying to think about the clinician that they're working with or the office manager. And so if you're creating something for a patient, like nowadays patients have access to all of this data about their health, which is great. But the point is for sure the patient to have that data, but to also share it with your healthcare provider. And now healthcare providers are just so overwhelmed with all this data. They already have so much on their plates, all the administrative stuff, prior authorizations, and they don't have time or the bandwidth to digest all of that. So if I'm working with, a startup company, they're creating something to help patients like that, I have to remind them that, okay, but in order to make this actually actionable, you need to keep in mind the clinician or whoever else they're working with, because it's all part of the system. So you can't create something that's totally separate. Patients are going to navigate our healthcare system as complicated as it is. And so you need to create something that will fit into that and be able to meet the needs of all actors involved. So, I can completely relate to that.
And once again, it's the collaboration that is necessary to impact outcomes by making sure the patient, the clinical, and the administrative side all are in lockstep and all have a seat at the table. That you are the voice of the patient, that the clinician is the voice of the clinician, the nurse, but also that the administrative side, in my case, dealing with HR, in creating a modernized employee experience, which is not healthcare's biggest strength. How do we have everybody working together? And that's one of the biggest gaps, because in many cases, I've done nurse engagement programs that were sitting down to finalize over a 25,000 employee health system. And we get to the boardroom and there's no nurses there. I have a doctor that left the bedside to solve problems for the bedside, as an entrepreneur. And he called me up the other day and said, Jeff, I'm so frustrated that these healthcare administrators, they just don't get it. I and my colleagues need this product, but they won't buy it. And I think that's part of the frustration me and you deal with all these founders and amazing innovators, that it is really difficult to build a business case for healthcare administration because they do lag behind investments in their people, investments in patients, investments in wellness and well-being, mental health of the clinician. Because if you can't care for yourself, you can't care for the patient. No matter how much, no matter how good you are, no matter how purposeful you are, no matter how much you love being a healer, if you're not well, you can't show up for your patient.
Right. That's why there's so much burnout. And, working in the digital health space now, there are all these clinicians who are coming from patient care into this space because honestly, a lot of them are burned out or they get disillusioned with practicing medicine and they want to create these solutions that can hopefully make that better. But it's so true.
Healthcare, and I always like to say, just say this out loud. Healthcare is one of the few industries that doesn't involve the people with the problems in the problem solving.
Yes.
if that makes sense, or it doesn't make sense. But and by the way, I say many times, sometimes it's not sinister. I remember talking to a CHRO and about, hey, why isn't there a nurse at the table here? We're doing something for them. And she goes, oh, they're too busy. And I'm like, okay, so it wasn't coming from a bad place that they didn't want to incorporate them, but it's just like, oh, our doctors are too busy, our nurses are too busy. No, slow down and involve the people with the problems in the problem solving. Because as you said, and I like the way you put it, that you help, create tools and platforms that patients choose, trust, and rely on. Because without you being the voice of the patient, the adoption of these solutions are not going to be where they should be. Just like I said to that CHRO that day, I ended the meeting. I had 7 people fly in from across the country for my company. They were freaking out. I was in trouble. I got slapped on the wrist a little bit for that. But when I spoke to the CHRO later, I said, I couldn't in good conscience bring you this solution without involving the nurses in it, because it would have failed, because the adoption wouldn't have been there, because we never got the voice of the nurse on a solution for the nurse. It would be, just the flavor of the month brought to them by administration. And ultimately, we had a successful deployment after level setting and getting the nurse leadership, the frontline nurse, the CNO, all at the table to figure it out. So your voice from the patient side is not only needed, it's a necessity for a positive deployment of whatever digital health solution you're working with. And I know you work with a lot of amazing ones. So, for your digital health solutions that are around patient engagement and outcomes, you need someone like Meredith, because without that voice, your solution won't get used. Without the voice of the nurse, my nurse engagement program won't get used. And you said a key word, actionable. We need a solution that ultimately is actionable and ultimately leads to how a solution is designed.
Right. And that just seems intuitive, right?
Yeah.
Right.
So,
And yeah. And in any other industry, you'd ask the end user what it is they really need. And like the reason that I really decided to focus my consulting company on the digital health space is probably about 2.5, 3 years ago. I talked to this woman who was a researcher at a very prominent institution. She was creating this, I guess you could call it a device. And for 3 years, doing all sorts of studies, building it. And I could tell within not even a minute doing my research beforehand that there was absolutely no utility for it. And I had to, because it was my super niche. I focus on chronic illness, and then obviously because of my IBD lived experience, I focus on GI, and then I also accumulated other conditions along the way. I have postural orthostatic tachycardia syndrome, PCOS, Ehlers-Danlos syndrome. I've always had chronic migraine, all of that stuff. And so I said to her very diplomatically, there's no need for this because of X, Y, and Z reasons. And she said, oh, I wish I had talked to you 3 years ago. And then she finally talked to the clinical team too. And they're like, yeah, we don't have a need for this. I'm like, validate. You're like causing all of this need for rework. And from a business perspective, there's feature waste and, having to constantly pivot, and you're, losing, money, time, other resources. So and you're saying before, it's not, like they're not doing it from a place of trying to cause harm. I forget the word you used. Like sinister. I find that for the most part, they're innovators who just don't understand it's important, but most understand it's important, but they just don't know how to engage patients in what they're creating. And so that's kind of where I come in. But yeah, talk to people.
I was talking to a technologist. I used to work for a very, very large company. The majority of my career has been entrepreneurial, but I worked for a very large company. I was talking to a technologist that designed major apps for huge organizations, through Apple and Google Play Store. And I just said to them one time at a conference, I said, what makes a good app? And they said two things. It's easy to use and it works.
Yeah, right.
So when you think about, and so when you think about, these solutions, will patients adopt them if they're not easy to use and they don't work? And the same thing on the clinical side. If the clinical side feels as though a solution for them is not easy to use, then that's the last thing they're going to adopt, because they've already been through the EHR nightmare that is not easy to use and doesn't always work. But anyway, so
Yeah. If I could, I want to add something to that, is that from my perspective, because for UX, that usability, reliability, the functionality of it is what's important. But from my perspective, what I do with patient experience is a kind of deeper, more nuanced look into that. Because from my experience, patients aren't going to use something unless it makes them feel seen, supported, and empowered. And I know you kind of use a similar verbiage in what you do. But there's so much health tech out there, and patients have so much health tech fatigue. And in the healthcare system, when you're a patient, you're, mostly in a vulnerable type situation, and you need something that is not only going to meet your kind of logistical, practical needs, but is going to, support you emotionally, psychosocially, being aware of all the social determinants of health and things you're navigating. So I think that's kind of what I bring to the table too, is sure, you can create something that works, but there's this added layer when you're in a healthcare situation and you're supporting patients. And that's what keeps people coming back. I always say that you're trying to create something relational. So rather than something that, helps you navigate, it's a navigator or it's an advocate. I always ask patients, okay, if this product were a person, a role, who would it be? What would it be? Would it be, a best friend to someone that just, can listen to you? Or is it a nurse navigator who has that clinical expertise, but also that kind of advocacy? So you're creating something with a personality and something that really meets patients' needs in a more nuanced, supportive, holistic way than just, helping them ensure that, they can get in to see their dermatologist or something for, a referral from PCP. So that's what I love to do too.
Technology with a personality. That's great. And you said, I use slightly different verbiage. I say in the world of engagement, on the patient side, I believe they have to feel seen, heard, and cared for. And on the employee side, they need to feel seen, heard, and valued.
Yes. It's so important.
So anything you'd like to add just on the landscape of digital health and some of the challenges, or anything positive as well? Anything you'd like to add before we get on to the moments?
Yeah. It can be frustrating that investors don't want to invest largely in direct-to-patient tools. And it can be frustrating when I'm working with a startup and we know this could be so important, but they want to know that it's immediately going to make them money. And, a lot are focusing now on more like payers and also in employer benefits. And so that can be frustrating, but I am heartened every time I connect with someone like you who, or, all the people in the healthcare reinvention collaborative. Like we find people who are like-minded, and I just really hope that we can all come together. That's something we were talking about in the last HRC meeting that I was part of, is we're all doing amazing things, but we're also kind of siloed. And so we need to find ways to come together to bring all of our expertise to really make that change. But, you know, it can be tough, but I have hope for the digital health space because we can't deny that it's part of care now, and it's not going away.
And I work with these founders to level set and rebuild the business case for these solutions. Because many times when I sit with a founder, they'll say, well, Jeff, this is going to impact retention by this number. And I just stop them right there and I say, throw that out. Because there's not a CFO at a health system in the world that will give any one solution, any hard dollar ROI for retention. So the one thing I teach all my founders, here's the good news. We have the answers to the test. Okay. If we invest in our people and we invest in our patients' experience, if we invest in that, I have never seen a time where someone, deployed an employee engagement program, a professional development solution, a real modernized wellness program, not like a wellness room or something like that, but a real something that really impacted people's lives. I have never seen any of those projects implemented in the world of healthcare where HCAHPS didn't follow with a positive result. So HCAHPS, to me, is the key to the justification of any solution, because HCAHPS is unique and that every single persona in a healthcare system cares about it, even finance. So, because there's implications. So we have to be very intentional about how we build that business case to get these solutions in the hands of the patients and the caregivers that need them. So anyway, the name of the show is Moments of Experience, and I know you shared with us your long journey. So I'm sure there is more than one, but I ask every guest, what was the moment that shaped you, moved you, and inspired you to pursue the purposeful outcomes that you do in healthcare and beyond?
I know. I was reflecting on this for like a week. I said, I have so many moments. How do I distill that down? And I think there are some kind of micro moments of, the surgeon coming into my hospital room the night before surgery and saying, "You're not getting surgery, slam the door, leave." And that surgery was supposed to be life-saving. And I was just left to pick up the pieces. And my parents and I are like, what? So that's, kind of a negative experience that made me realize, okay, I need to fix this as much as I can, or at least raise awareness that this is not something that's okay to do. It doesn't benefit anyone. And then the amazing experiences, like I met my now husband like 2 weeks before I got sick and went inpatient. And so we never really dated. He kind of just appeared in the hospital, and the rest was history. But we were supposed to go to it's called the diplomatic ball at Georgetown. And obviously I couldn't because I was inpatient. And the child life and social work case management team put together a little ball, a little dance in my hospital room for me. I unhooked from my IV. I put on a little dress. My mom brought food. And we were alone for about 5 minutes. And then the little girl next door, whose parents couldn't be with her much, she came over and we had a little dance party as much as we could. And so there are moments like that where they can really just transform those moments of fear, despair, grief. But I'd say that a moment that really helps me realize the true power of sharing your story and how empowering it could be was I had gotten my surgeries, and once I was stable enough to be out in the world, I went and volunteered on the same floor where I was at Georgetown in the C53 and C52 transplant and hem-onc wards. And I was shadowing the social worker because I thought that maybe I wanted to go back to school for clinical social work. And we were going from patient to patient. And there was one patient who I think was about 19, 20. She was also a Georgetown student, and she was dealing with a really severe eating disorder that landed her inpatient. And so I went in with the social worker, and I'm just there shadowing, so I'm quiet. And the girl is saying, I got to get back to school. I got to get back to class, and really not thinking that there was space for her to get the treatment she needed. And, I can understand that. You're a 20-year-old, you're at kind of in a high stress situation. You need to achieve. And so the social worker was trying to give her her options, but said, okay, I see and respect that. And we left the room. And I said to the social worker, I think her name was Katie. And I said, Katie, when is it appropriate to bring up a personal story? And she said, well, in my opinion, it's when it is meant to serve the other person and not serving you, when it's not about you. And so I said, okay, is it okay if I go back in there and talk to her about my experience? And she said, sure, let's go back in. And I said, hi, I'm a Georgetown student too. I got really sick my sophomore year, and I was terrified as well. But my dean was so helpful. My dean was like about to pop pregnant, and she came to the hospital to see me because luckily it was just right across campus. And she said, we'll do whatever you need to take care of yourself, to get healthy. I was able to withdraw and everything. And I withdrew again and then took off a whole year. They were so supportive. They even waived my study abroad requirement for my major because there was no way I was going to go to Egypt the way that I was. I was actually scheduled to go that summer, but then all my friends ended up getting recalled by the State Department anyway because of the Arab Spring. But I was just real with her, and I said, they're there. They can support you. And she said, thank you so much. And I learned that she was going to get treatment and talk to her dean. And just the fact that sharing my story could help her in that way to prioritize her health and realize that's most important and ultimately will allow her to be able to go back to school and be healthy. That just meant so much to me. And just to know that revealing these vulnerable parts of our experience can help other people is why I do what I do. Because so many of us are not seen or supported or empowered, or there's a lot of gaslighting. And just to know, hey, I have been here. This is what you need to do to advocate for yourself, but they're going to support you. That was a real kind of turning point for me, and realized, okay, this is what I want to do.
When you think about just the beginnings of this podcast, it was because I just saw when I left my cushy corporate job and went out into the world to try to innovate healthcare. And for the first 3 months, I don't think I saw one positive story of anything going on. Everything was negative. And all of a sudden, I just kind of looked back and said, well, what did I do? And the one thing that keeps me going in doing this medium and this show is the messages from people that hear your story and they hear other guests' stories and say, I mean, I had a CNO on who was speaking about his battle with mental health and suicide ideation and suicide attempts. And when you think about that stigma in healthcare, the caregiver is not well and not wanting to admit it and not wanting to seek help. When I get notes from nurses that say, I heard that episode and I'm getting help now. That I heard Meredith's story and I always thought I was alone. I always thought that this pile up of all of these issues was just me. That no one else would ever have to go through what I'm going through, and just knowing that what Meredith is doing on the heels of what she's been through gives me hope. Those are the types of stories, and I think you said it perfectly, or the social worker said it perfectly. The personal stories need to be told to help others.
Right. And if I may, this is something that you can make happen in a digital format. I was working with the first digital health company I worked with that unfortunately was not able to secure funding to continue after 3.5 years because that is startup life. But we were creating something so meaningful for inflammatory bowel disease patients. And we made sure to incorporate stories and articles written by other IBD patients into the app to be able to send those to patients, our users who are going through certain things. So there was a user who messaged in, I think she had Crohn's, and she was saying, my husband thinks I'm just lazy, that I'm in bed all day, and I'm in so much pain. And I just don't know how to make him realize that, no, I'm not being lazy. I am in so much pain. I can't get out of bed. And I just feel so alone and not believed. And so we were training the AI to be able to respond like a human, like someone who understood, someone with lived experience, but also clinical background and understanding. And so for when we were training it, it was kind of us behind the scenes. And so the AI persona, i.e. me, responded and was saying, I'm so sorry to hear that you're experiencing that. You're not alone. Would you like to, for me to just listen? Or I'm happy to share with you our ambassador, Amanda, her story, her article that she's written about communicating with loved ones about what we're experiencing. And so I sent that to her, and she said, "Thank you so much. I have never felt understood in this way, and to know that other people have navigated as well just means the world to me. I'm going to go talk to my husband." And just something so simple to be able to recognize, validate, say you're not alone, and then be able to send an actual patient who, has the same, things that they're navigating, same disease, X, Y, and Z, is so powerful. And that can happen if you're including patients into the development of a solution, because they know what it is that they really needed in those moments of despair, isolation, not feeling understood. And to be able to provide that to our users, that's what a real, genuine solution is, rather than just, "Oh, I'm sorry, that stinks. Rest is important." We're helping them to figure out how to live and navigate their life.
Right. My wife, 3 weeks out of every month, has to take an oral chemo to keep her cancer in remission. That completely zaps her energy. That basically she sleeps much of the day. And there was times originally when she reported that to her doctor that the doctor kind of dismissed it and said, yeah, there's some lethargy associated with it, but not at that level. And there was almost guilt from my wife's perspective until we found, because I knew right away, she didn't have to explain anything to me, because I know my wife and I know the last thing she wants to do is be in bed at 3:00 in the afternoon. Okay, so she never had to explain anything to me, but we finally found some people that said, yes, that level of lethargy can certainly come about, from this medication. And it was a real important moment for her, to realize this isn't just me. I'm not alone. And there's not something wrong with me. So those real patient stories are really important. So anything you'd like to add before we sign off? I so appreciate your time and your stories. And this has been a great conversation.
Thank you for providing the platform that you do. And I know this is Moments of Experience in honor of Mo. And I have 2 dogs who are so important to me and I was bedbound for 3 years, about 3 years ago, and because of my pain. And my dogs are always in bed with me, and they are quite rambunctious. I have a lab pity mix and then a pity Basenji mix. So they get very excited, especially when we come home. And but dogs just know when I had kidney stones during the pandemic, and I couldn't get out of bed. And so the EMTs had to come get me, navigate the stretcher up our tight stairs. And they got me on the stretcher, and my dogs just realized, all right, something important is happening. Mom needs help. We're just going to go sit over here and be calm. And they just know. Or when I've had muscle biopsies taken from my legs and I come home, they kind of sniff my legs and go, okay, we can't jump up on Mom. She has something going on. And they're just so, so important. And I know how much that Mo has supported you and your wife through everything. And I actually did another podcast a couple years ago purely on my dogs and how they've impacted my healthcare on the About IBD podcast. And so I want to thank Mo as well for providing you all with the support and love, because they truly are remarkable. And they just know and can provide that understanding and love and support, and saying, hey, I know you just need to chill today, and you just need me to chin on your leg and just look at you with love, and we're going to be okay. So thank you so much for creating this platform. I truly listen to it every couple of days when I need a boost. So thank you. I am so thankful for is my friend Sarah, who messaged you in the app and said you need to talk to Meredith. And so I am so thankful for her as well, connecting with us. And thank you for everything you do. You are a rock star, and I'm so thankful to know you.
Well, thank you so much. And this is a tease for my next episode, because I have an amazing innovator in human experience in the workplace. Her name is Jen Marr. And she recently did a post around dogs. And she said, dogs don't let their brains override their heart. They see when you struggle. They don't need words to be there for you. They forgive quickly, and they're always happy to see you.
That is beautifully said. I might be tearing up.
Yeah, absolutely. So, anyway, thank you so much for your time, and keep doing what you're doing. Keep fighting the good fight. I'm there in parallel with you.
Thank you. I appreciate it.
Thank you for joining us on Moments of Experience. I hope today's conversation touched your heart and inspired you to reflect on the impactful moments in your own life. Remember, it's the seemingly small moments that often hold the most significant power to shape our lives and the lives of those around us. So keep your eyes open and do your best to be authentically present. If you enjoyed today's episode, please consider subscribing, leaving a review, or sharing it with someone who might benefit from our discussions. Until next time, I'm Geoffrey Smith, reminding you to cherish the moments that bring hope, connection, and purpose to your journey.